If I can continue with my second part of my second presentation, it will be shorter. As I said, one of our problems, just not to say the main problem which we have with the maggot debridement therapy, is the pain. And perhaps we talk about the psychological landscaping of maggots, and we have approximately 35% of our patients who have already a priori painful wounds. Of course, the moment you add inside also the maggots and they start going around, it can, if you want, so get only worse. Now I'm showing the number of patients which we treated from 1996 to 2010 until the last moment, and also not only the Hadassah hospital, but I will show you also in other hospitals of Israel. Let's say in this case this 418 with 662 wounds, and in a number of hospitals and clinics, whether it is in Jerusalem area. These patients I am still treating myself. It is not far away from the hospital I am treating. But in the meantime, we gave all kinds of courses to physicians who were interested to introduce the maggot therapy also in their hospitals. And as you can see, in different cities of Israel, there are hospitals which are receiving from us the maggots, and they are doing the treatment by themselves. We show them how to introduce them, how to take them out, etc., and in which case to use, and in which case it is not advisable to use maggot debridement therapy. As you can see that by asking the patient, and of course that is a very, as you know, emotional, subjective effect. The question of pain, you know, sometimes you look at the eyes of the patient who can start screaming. There are others that you can put maggots and you know that they are suffering, but they can control themselves and they are ready to suffer without making much noise if you want. But anyway, we ask the patients after each treatment whether the pains were the same, less, or more. And as you can see, with about 38% of the patients, they reported really an increased pain during the maggot debridement therapy. In 16 out of 39 patients who were treated with concealed maggot, it was 41% of the patients. So that said that they had increased pain, while with the free-range maggot it was 34.6%. And here you will say, but before you told us the opposite, that the concealed maggots, they cause less pain. That is true, at least that's our clinical experience, but you must know that the concealed maggots, we put it a priori in wounds or in patients which have very strong pains. I mean, there we know it. If we would put the free-range maggots, they would not keep it. They couldn't stand it. So we put it, the concealed maggots, as we said, in even more painful wounds. That because also there's difference. And in 5 patients, we discontinued the treatment because of the pain. Just to show here one of the last patients which we treated, he had close to 40 wounds. As you can, some of them you can see it, big ones, very small ones, as you can see it here. And as you can see, it is quite superficial, and we can put it here also the concealed maggots, while in very deeper wounds, if we would put it, of course, that kind of things would not allow that the maggots can work with the deeper parts of the wound, and and I don't want to show you how we make these dressings, etc. Why these pains, especially with the apical hooks, which are in the two teeth, which are in the apical part of the maggots, the scales, which are on the body surface, where immediately the physical contact and movement of the maggots, and of course their secretion, excretion, usually enzymes, and of course in an open wound, all kinds of these things would make. There are the two teeth. As you know, the maggots are acephalic, which means they don't have a head. The whole is just a body with two tooth which are coming out, which they use it also to move. They just attach with the two and pull their body forwards with this two, which they use it as a kind of leg. And if you look a little bit in higher magnification of the body, you will see the scales which are on the surface of the maggot, which of course are on the wound, will cause additional pain. What I wanted to say about this, we talk about now what it is that first of all, we are always in contact with our pain, the how it called pain institution, which it is anesthesiology. Yeah, exactly. Let's say with the Department of Anesthesiology, which they come and visit our patients, especially those who are a priori complaining from pains, and they know what the maggots more or less can do as causing pain. So they started from with different medication according to the level of the pain. It could be some optalgins and aspirins, etc. But later they start also with transcutaneous analgesic, and if it's necessary, in some patients, even peripheral nerve blockers. The advantage of the method is because within 2-3 days, we can clean the wound, so they can do even some thing on that kind of treatments modalities, because otherwise, anyway, the patient will remain with his wound and suffer for weeks and months. So better to, within 2-3 days at least, to clean his. What is the additional methods to alleviate the pain? Of course, we can use it for shorter periods. I mean, we can use the maggot therapy during the day and remove it before we go home, so that the patient will not remain with his maggots whole night, which according to the development, exactly during the night or during the early hours of the day, the maggots are becoming bigger and stronger, and the pain, of course, can be even stronger. Wherever it's necessary, we use the concealed rather the free-range maggots, and we can use also smaller maggots. I mean, just hoping that they will they will cause less pain, and we can use also fewer maggots. And here, as you can see, with the concealed, and if we take the literature already in the in the 2000 approximately, we reported that about 20-24%, 25% of patients were feeling increased pain. Sherman also reported about 38% of the patient. Volina, etc., about 40% of their patients. Also, Wolf Hansen, about 34% of their patients. They had more. Lately, Sturworde in 2006 had also in 30, what was that? More pain, 8 out of 20. With other words, also, Dunwell had similar results, which makes that, in conclusion, really 1/3 of our patients, they are suffering, and we have to interview them before. We have to give them the necessary medication and take the necessary steps in order to minimize this problem and make possible the treatment of maggots in order not to come to a situation that either the patient will suffer or even stop the treatment. And due to the fact that within 2 or 3 maggot cycles, we can debride the wound, even we can use strong analgesic, etc., in order to make this treatment possible. Thank you very much.